Hi, this is Dr. Del Grosso from SF Chiropractic, and today I want to talk just a little bit about elbow pain and problems with the elbow. Typically, there's two things that we deal with the elbow. Remember, the elbow, you have a lateral epicondyle and medial epicondyle, okay? And the conditions that go along with it is one, lateral epicondylitis, or what you normally know as tennis elbow, or medial epicondylitis, which most people know as golfer's elbow. They also call it little leaguer's elbow. So let's talk a little bit about the difference between the two. Okay, with lateral epicondylitis, the lateral part here, what it does is it causes supination, extension of the fingers, and extension of the wrist. The medial is pronation, flexion of the fingers, and flexion of the wrist. So when we're addressing these problems, we're going to deal with it in that way. But before we do that, there's two types of muscles you have in your arm, okay? You've got stabilization muscles, and then you have the muscles for active range of motion, okay? So before we can use the active and work on the active muscles, we need to stabilize and do the stabilization part. And the stabilization part is a muscle called your brachioradialis, okay? That muscle is a band that goes up and it stabilizes the arm for these other actions. That's what we need to work on first, and there's something real simple that you can do to work on that. And basically you hold your arm like this, hands up like a blade, okay, and you're going to bend it up like this and turn back, bring it down, bend it up like this and turn. That's working brachioradialis. That's stabilization. That's the first part of this we want to do. We want to work on that for probably 2 or 3 days to try to work there a little bit before we start into the other. And then the other part is, let's say you have medial epicondylitis. Well, I told you the action of that is flexion of the wrist, flexion of the fingers, and pronation like this. So what are we going to do to work on that? We're going to do just the opposite. We're going to extend the fingers, extend the wrist, and we're going to supinate the hand. Okay, you do each one of these separately. You should hold it for about 30 seconds. So you take the fingers, extend the fingers, tilt the wrist back, hold it for about 30 seconds. Do that 2 or 3 times. Same thing like this way from pronation, supinate. Hold it for about 30 seconds, 2 or 3 times. Within a week, if this doesn't resolve, you need to come and see us or go see your doctor and take a better look. But that should make a difference. If it's lateral, okay, remember I said the action there is what? The normal action is extension, okay, of the wrist, extension of the fingers, and is what? Supination. So for that part, we want to do just the opposite. We want to take the hand, we want to flex it and bend the fingers. We want to flex and bend the fingers. And then the opposite this way, we want, instead of supinating, we want to take it and pronate. Okay, again, each one, take it, bend the fingers, flex down 30 seconds. Supinate, pronate, 30 seconds, okay? Do that 2 or 3 times. Between these things, it should resolve. Again, if it doesn't resolve, you need to come and see us or go see your doctor and take a closer look, okay? Now that we're finishing that, let's talk a little bit about the holidays, because we got 5 days till Christmas, and everybody's excited about Christmas, and we have New Year's coming, so I'd like to wish everybody watching this very, very happy holidays, a Merry Christmas, and have a great New Year, and hopefully excuse me, I got tongue-tied, I got so excited. We'll look forward to seeing you in the new year and come into the office, and we'll have a little New Year's treat for you. How's that sound? Anyway, you guys have a great holiday, okay, and we'll see you next year.